Mrs. W. is a retired nurse living alone in an apartment. She is 83 years old and moved from the East Coast at her only daughter's request 1 year ago. As she doesn't see her daughter as often as she would like, she talks about regretting leaving everyone she knew behind. Her main social contacts are with the personal support workers, PSWs, and nurses who care for her in her home. Mrs. W. has macular degeneration, severe arthritis, and COPD. The visiting nurse has observed that Mrs. W.'s overall functioning has become more compromised in the last 2 months. She's struggling to go about her daily life, and because of worsening arthritis, she mobilizes much less than she used to. The PSW reported to the nurse that when he arrives in the late morning to help with personal care, Mrs. W. is still in bed, with the curtains drawn. The apartment is quite cluttered and disorganized, with unpacked boxes still piled up in the living room. The nurse has asked Mrs. W. several times if she is called to inquire about community resources and activities she might want to get involved in. Mrs. W. just says she keeps forgetting the numbers. The nurse also knows that last month, the superintendent had to remind her to pay her rent. The nurse noticed Mrs. W. has lost weight over the last several months. Her fridge is almost empty, and there are uneaten meals scattered around the kitchen. Concerned, she asks Mrs. W. about it. Mrs. W. tells them that the money spent on food is largely a waste because of her stomach problems. She quietly whispers that she needs to eat less anyway because she's afraid she won't have enough money to last for the rest of her life. The nurse asks Mrs. W. about her mood recently, and she says she just doesn't feel motivated to do anything these days. She can't see the point anymore. The nurse and the PSW look at each other, both recognizing signs of depression.